Hospitals in the Philippines are preparing for an exodus of nurses. Let's have a look. Hello everyone, Florian.heise here and welcome to another episode of HeiseSays. Grab your stein of coffee. We're going to have a look at an article here which is discussing what's potentially happening in the Philippines with an exodus of nurses as the Delta infections surge across the country. Now, nurses, well, they've got tough jobs everywhere, let alone in the Philippines, with low wages as one of the reasons. Now, before we have a look at this, let's look at the Johns Hopkins map, and I'll bring this here for the COVID data from the Philippines. You can see it here now. They've had 4.1 million cases, everyone, in the Philippines, 133,000 deaths. Now, of those 4.1 million cases, 593 were in the last 28 days. So you can see, I think you can, over here. We can see here where they're getting another huge spike in cases. But the deaths are also spiking, everyone. If we go here on daily deaths, we can see what were they looking at, over 1,000, 2,000 at one stage. They're down now to just over 500. So hopefully they've seen the peak of it and it's heading down. Where daily doses of vaccinations, 1 million, 2 million, where they're here, 1 million. Look at those numbers. Those are crazy high. So they're definitely, they're in the middle of it. The last 28 days have had over 34,000 deaths in the Philippines. So let's have a look at this. So concern is brewing for a mass exodus of health workers in the nation's worst hit by COVID-19 in Southeast Asia, where nurses work around the clock for the lowest wages in the region. Now, the recent surge in COVID, particularly the Delta, a lot of it is happening in Southeast Asia, everyone, very close to Australia. An estimated 40% of nurses serving private hospitals in the Philippines resigned last year, 40%. And that number is expected to rise as the country grapples with the Delta variant. Hospital intensive care units are reaching peak capacity, and case numbers are mounting rapidly, with the average daily infection rate reaching a record 16,937 in the past week. Just looking at these numbers and comparing them to Australia, it shows you, doesn't it? The number signaled an increase of about 20% compared to the week prior. As they've done for the past 18 months, Filipino doctors and nurses continue working furiously to save critically ill patients, but many complain their efforts are not matched by their pay. It's easy to see why. Nurses are paid just $1,100 a month, a drop in the ocean compared to those in Singapore, where the pay is almost $6,500. Yeah, can you compare the Filipino cost of living to Singapore? No, come on. Look at how cheap a house you can get in the Philippines. An additional 5% have resigned since the Delta outbreak began in April, according to the Private Hospitals Association of the Philippines Director, Jose de Grano. Some transferred to government hospitals because they were offering much better salaries, he told the ABC. Nurses were threatening to go on strike if they didn't receive a back payment of a promised additional $137 a month as a special risk allowance bonus. Can't blame them. President of the Philippines Nursing Association, Malbert Reyes, echoed the pleas of his members, demanding their calls for decent pay be answered. The salary and compensation of nurses in the Philippines is nothing compared to those in other countries, especially in the UK and US, the Middle East, he said, the ABC reported. Filipino President Rodrigo Duterte ordered the health and budget ministers to pay health workers what they were owed within the next 10 days. Pay them, use whatever money there is, he requested of Health Minister Francisco de Q. With the Delta variant having been detected in 16 out of Philippines' 17 regions, vital healthcare workers are reportedly seeking positions abroad with better pay and conditions. Large numbers of workers have historically relocated to the United States and Saudi Arabia, making the Philippines the biggest exporter of nurses in the world. Well, there you have it. The trend hasn't slowed down during the pandemic either, with so many health workers moving overseas last year that Manila implemented a ban. While the ban was later lifted, the country still limits the number of health workers allowed to flee to other countries. We can't stop nurses looking for better opportunities outside the countries because they can't find opportunities in the Philippines. Even in the pandemic, they're hoping to get offers to work abroad, Filipino Nurses Association President Malbert Rees said. We're afraid the time will come that there will be no healthcare workers to take care of our people if we allow them to leave. About 15% of the country has been fully vaccinated, with about 32 million doses of COVID-19 vaccine being administered. So they're at a low vaccination rate. So, well, what is the solution or the takeaway here, everyone? Well, you've got to understand, they are in a global market. They're no different to us here in Australia, where we are losing our manufacturing jobs to countries overseas because, their conditions are cheaper and they're more competitive. Philippines is going to lose their educated healthcare providers and professionals because better conditions can be provided in other parts of the world. That's just how it is. It's going to have to equalize. They're going to have to up the pay they pay their health workers. And, well, if that means they're going to have to up the pay for their health workers, they're going to have to up their taxation. And then that'll have to drive up other things as well. And it just flows through in the economy. I wonder eventually if everyone in the world will earn the same thing. The solution for the Philippines is pay them more. And for other countries, there's a potential source of workers there to have a look at. What do you think, everyone? As always, let me know your thoughts and opinions on this one in the comments down below. If you're a fan of the channel and enjoy the content I cobble together here, there are a few ways you can support us. You can join us on YouTube or Patreon. Sign up for SelfWealth or Stake. Use our affiliate links at Amazon, eBay, Independent Reserve or AussieBroadband. You can buy our merch from HeiseSays, use Gold Paths from the Perth Mint, or support us via PayPal. Take care, everyone. I'll see you next time. Bye for now.